Can I be heard?
All right, Trish is unmuted.
Okay. Okay, wonderful. Well, I want to thank you all for coming for this wonderful event. And Dr. Glenn, I'm happy to see you as well again. Dr. Hellen, first of all, Dr. Hellen, I have to tell you how much I love talking on the phone with you.
Oh, thank you.
And I told you that before the other day. For those of you who don't know Dr. Hellen Greenblatt, quite a brilliant woman. She has 2 PhDs, or dual PhDs in microbiology and immunology from SUNY Medical Center, Downstate Medical Center in Brooklyn. And I find it hard to believe that you're old enough to have been at a school that was founded before the Brooklyn Bridge was built.
You're right.
That is awesome. And obviously a product of the product because you look fantastic. Dr. Hellen's research on inflammation and what it creates in the body, basically attacking itself, has led to this great product that we now have the fortunate ability to use through longevity, and it is the I-26, amongst other really good products in this Legacy for Life line. And inflammation, if you're not aware of it, which is hard to believe, but inflammation is, I don't know, maybe it's safe to say, Dr. Hellen and Dr. Glenn, that inflammation is probably the majority of the issues with chronic health issues in the United States today. And
I would say that definitely, it's the reason we have most of the problems we have. And if not, any other condition we have is also associated with inflammation. But we'll be getting into that in a few minutes.
Right.
So we can expand upon that afterwards. Sure.
Yeah, so in one way or another, this product that has been formulated really helps, I would say, also the majority of the people in the United States right now who are suffering from inflammation, whether they know it or not. So with that being said, Dr. Hellen, take it away.
Okay. Well, I hope that most of you realize that all over the country now and in Canada, believe it or not, the emergency rooms are just flooded with some of the highest numbers of cases they've seen in years. And, in fact, 2 weeks ago, I was talking to a physician. They're still having the same problem, that their patients are lined up in the hallways and they can't transfer them to other hospitals because even as far away as 50 miles from her hospital, they're packed. People are in the hallways. And then the schools all over the country, there are a lot of schools now where the kids and the staff are out, and the schools are being closed down. And the problem with some of these viruses is that even if someone feels better, they may still be contagious. Now, what do we need to do to help people? And first of all, these people desperately needed to increase their immune system support before this happened, so maybe they wouldn't have gotten ill. And now that they are ill, they need help in order to get better. And what does that? It's inflammation. I think what's important is that people don't realize that without inflammation, we cannot survive on Earth, because inflammation is the body's natural immune response to infection, to cancer, to injury. Okay? So what triggers inflammation in our body? When the body recognizes that it's been invaded by viruses, bacteria, molds, parasites, cancerous cells, the body starts the process called inflammation. And what it does is it produces white blood cells, immune cells, that attack these pathogens or the cancer cells that they've seen. And these cells will release immune molecules that then help the body control infection, attack organisms, and also for healing. Okay? And what happens is that more white cells will come into the area, and what they'll do is they'll start this vicious cycle. The problem is, as Trish just suggested, is that if you have too much inflammation, you have inflammatory disorders, or something called an autoimmune disease, auto meaning against yourself, where the body will turn on itself and attack healthy tissue. And you know, I like to think about inflammation as almost being like a forest fire. Firefighters may set a fire to clear out the undergrowth in the forest, but if the conditions change, if the wind changes its direction, or a myriad of other types of problems can happen, the fire can get out of control, and then it burns down acres and acres of trees, thousands of acres, in fact, as we all know. And I always see inflammation as being similar in the same way, that it's almost like the body's trying to burn out these cancerous cells or these pathogens, okay? And very much like a fire, that a runaway fire, or runaway inflammation is too much inflammation. You need enough inflammation to handle the challenge in the body, but not so much that it's causing damage. And I like to suggest that inflammation is all about location, location, location. Every inflammatory response is basically the same no matter where in the body it's happening. Think about the word itis, okay? Arthritis, that means you have inflammation of the joint. Colitis, you have inflammation of the colon. Hepatitis, liver. Cystitis, bladder. These all itises mean there's an inflammatory response going on that's too much. And then there are these autoimmune diseases that Trish referred to, where the body is attacking itself, such as diabetes and lupus and multiple sclerosis and Crohn's disease. These are all the result of this runaway inflammation. And there is so much data, you know, it's like for the last 20, 30 years, I've been trying to convince the medical profession to look beyond their medications and look at the body and realize that excessive inflammation, too much inflammation, plays a real important role in like fibromyalgia and Parkinson's and Alzheimer's. It's the new fad now. What causes this chronic disease, that chronic? Oh, it's inflammation. Duh. You know, this is what we've been saying at Legacy for years and years and years. But the important part is that the body has to stay in immune balance, or what is known as immune homeostasis. You need enough inflammation to protect the body, to help the body heal, but not so much that it causes a problem. And think of immune balance as a car being in neutral. It's ready to increase its immune response when it has to, but it also knows that it has to lower that immune response so that it doesn't get carried away. And there are a number of very important ways that one can keep inflammation in balance, okay? One, of course, is you have to maintain good nutrition. You can't build a new house on a rotten foundation. If you don't eat or supplement right, your immune system won't be able to function to its fullest. But nutrition is not enough. Every day I hear, well, I take this vitamin, mineral, etc., but it's not enough, because nutrition is important, but you have to be able to affect the immune system in addition to having good nutrition. So, for example, another way to maintain an inflammatory balance, homeostasis, is exercise. Our muscles are really part of the immune system, because every time we contract our muscles, those muscles release very powerful anti-inflammatory molecules that help the body combat inflammation. If you ask people who have arthritis and fibromyalgia, how do you feel after you exercise, they will often say, I feel great. I don't know why, but I feel great. They think it's the circulation of blood. There's a lot of reasons, but one of the more important reasons is the fact that they're producing naturally available anti-inflammatories from their muscles. Also, for example, depression. Inflammation causes depression. Depression causes inflammation. If you exercise, they have shown that exercise can do even more than many medications in order to help a person become more emotionally stable. Again, because they are producing anti-inflammatories, and it helps the body reduce the amount of inflammation that is occurring. And you know, it's just this past week was a great article that show that physical activity doesn't have to be intense to help the body adjust its inflammatory balance. At the University of California, they show that even 20 minutes of walking moderately on a treadmill led to a 5% decrease in the immune cells, in the inflammatory immune cells. So, you don't have to be, an Arnold Schwarzenegger. You need to just be consistently trying to work out or being physically active about 150 minutes a week, about 2.5 hours, 20 minutes a day, every other day would be great. Another way besides nutrition and exercise is to maintain a healthy body weight. Our fat cells don't just sit there full of fat. Our fat cells are producing immune-like inflammatory molecules, okay? And that's why when people are obese, they have so many health problems. So maintain a healthy body weight is very important. But the most important way that I use to support immune health is by using the Legacy I-26, okay? It's an all-natural egg protein. That's all that's in there. White plus yellow, okay? The yolk plus the albumin. And, I'm considered by many to be a pioneering person in this technology. Some people have called me the world's expert on I-26. And I want to share with you why I and thousands of other people have been using Legacy I-26 daily for so many decades, all right? When you talk to people who use I-26, they're just blown away by what it's done for them. Because I-26 has been clinically shown to partner with the body to support immune, joint, digestive health. And there are a lot of products on the market that say that they boost immune responses. Remember, we're talking balance. People with arthritis and lupus and multiple sclerosis, diabetes, the last thing in the world they would need to do is boost their immune responses because their system is already overactive. What I-26 does is it helps the body support immune health in a balanced, natural way. And people have been, I'm a scientist. Dr. Glenn is a scientist. We needed to be convinced. And what convinces us, okay? What convinces me is number T, are the 4 T's: technology, testing, trials, and testimonials. So, technology. This technology was originally developed at DuPont, which is one of the Fortune 100 companies of the United States. There's no way that they would have been involved in a product like this if they didn't know that there was a lot of science behind it, because it's one of the kind of technology, and it's protected by so many patents that nobody else can produce it except for, we're the only ones who can produce it. And DuPont is not involved, by the way, anymore, hasn't been for decades involved in the product, but they're the ones who gave us the money, and they're the ones that said you have to patent this, because DuPont doesn't believe in having products that they can't patent it. And the second T, okay, technology, and then there's T for testing for consistent quality. Legacy I-26 is produced exclusively in the United States. Every batch is monitored by the United States Department of Agriculture. All products produced are produced in quality facilities that have to adhere to what are called standing operating procedures. Remember, this product came initially from DuPont. You have to have certain manufacturing, what they call protocols, in order to be sure that you have quality products, and that's what we've done. We maintain a paper trail from the chicken flock to packaging, and then we have a high quality testing by independent testing labs. Okay, so we have technology, we have testing for quality. The third T represents trials, and what we have, a trial run, first of all, has to be done in a scientific and ethical manner. Okay, it has to be done. We have most of ours done by outside laboratories, and to carry out a good clinical trial, you're talking about a lot of people and hundreds of thousands of dollars. And then you want to publish in scientific journals, and we indeed have numerous publications, both preclinical and clinical. That means both in humans and in other ways. And then the last T is the one which I like to say is testimonials. The wonderful part about Legacy I-26 is you can talk to people who have used the product for years and years and years, and they are not distributors. They just use the product. I have talked to people who are no longer distributors who still use Legacy I-26. And there aren't a lot of products you can say that about. You know, when most people leave a network marketing company, it's very rare for them to continue using the product. With us, the product is so phenomenal that there's no way they're going to give it up. And you can go to conventions and go to the meetings and talk to the people that have used I-26 for themselves or their pets. And you'll see they're all passionate about it because it's a phenomenal product. It makes such a difference in the quality of life of individuals. And it's real easy to use, okay? What I suggest is this. I recommend taking 2 scoops a day of Legacy I-26. And if you have a joint, you want joint support in addition, then you would also want to add the 2 capsules of Legacy Flex, F like in Frank, LES, okay? And you just start gradually. So you start with 1/4 of a scoop for a few days, 1/2 a scoop for a few days, a whole level scoop, add 1 Flex capsule, then go ahead and add two level scoops of I-26 and then 2 Flex capsules. Real easy, very easy to take. If it turns out that you don't see a response, give me a call. I'll be happy to talk to you and figure out what the issue is. You know, maybe you need more, maybe you need to take it with, take it differently. I add mine to V8 Fusion because they claim that it has a serving of veggies and a serving of fruit in it. People put it in orange juice and yogurt. I have one man who uses it only in his cold cereal. And you don't want to put it in boiling hot beverages because remember, this is pure protein. And protein will what is called dissociate itself. It loses its structural integrity. All right, and we'd rather not do that. So you don't want to put in boiling liquids, just like you wouldn't leave a dog in a boiling hot car. That's protein. You don't want that to happen. And that's about it. You know, introduce it gradually. If someone's a diabetic, some people have found that their body really responds very, very, very rapidly. So just start even more gradually. And I'll give you my phone number. My phone number is where am I? Is that all right, Marianne, for me to do that? Okay.
Yeah,
anyway.
Say your number and then I'll type it in so everybody can see it as
great. Well. So my direct number is 302-265-3870. Okay, 302-265-3870. You can also contact me, and that might be the better way. Contact me through the contact form on my website, which is Dr. Hellen with 2 L's, Hellen Greenblatt, .info. Okay, and Marianne has supplied that website to you as well. So all I can say is, if you have the idea that you want to be healthy, if you have relatives who are not doing well, maybe they're getting what to do. What we want to do is we want to help the people in society. And I don't know an easier way to help individuals than to help them change their quality of life. So I want to thank you all for joining us tonight, and I'm available if you have any questions.
Dr. Hellen, I have a couple of questions here, and thank you again for your time. One of the questions was, how will it help with Barrett's esophagus?
Remember, Legacy I-26 cannot cure, treat, or prevent disease. Okay? It's very simple. It's not a medication. It's a dietary supplement that works with the body. All you have to do is go to a browser and search and put whatever issue you're talking about and put the word inflammation next to it. And if it has to do with inflammation, that means that the body's probably producing too much inflammation, and balancing the inflammatory response will make a major difference.
Excellent. And another question was, with all the new viruses that are out since the product came out, is it still effective with the newer viruses that are starting to hit the populations?
What we have, this egg protein was developed with the idea of stimulating the immune system of the chicken, not against anything specific, but in terms of whatever challenges it gets exposed to, because this is pure egg protein. Okay, it's whole eggs, which have been what is called spray dried to get rid of the water. There's no specific organism that it has been stimulated against. What it is the body uses the information in the egg to figure out what it needs to do for itself. Okay? So, for example, many years ago, we had, it was swine flu influenza, I think, that some humans were getting in Asia, right? There was no solution for it at all, except what was happening was that when they were able to balance their immune system, their body was able to fight it off naturally. Remember, if you look at what used to happen during epidemics, there were no vaccines at that time. There were no antibiotics at that time. But not everybody in town died. Why was that? Because their own immune system was able to affect protection. And that's all we're trying to do, is help partner with the body to let our own bodies do what it was meant to do, which is to protect us from infection.
That's perfect. And actually, that is the same way that we in longevity, we use very similar language, is we don't cure anything. We give the body all the raw materials it needs to do its job.
That's all we're trying to do. That's right. We're trying to let the body do what it can do naturally, and just give it a chance to do that, and give it everything it needs to do that. Give it the tools.
Yeah. And I know Dr. Glenn covered this 2 weeks ago, and not everybody was on, so I'll ask again. What happens if you don't start gradually? What are potential issues that you could have if you don't start gradually with the product?
Really, there really isn't a big problem. There's some people, for some reason, especially on the West Coast, who think that they're a little sensitive to having it. And what it basically is the only people who have to really be concerned about starting it not gradually are people who have diabetes. Because sometimes people with diabetes balance so quickly that their blood sugar falls very, very too rapidly. Okay? So it's safer to tell people, just take it gradually. Look, you've been working with your own body now for 20, 30, 40 years. Give it a chance to figure out what it needs to do for itself. You don't want to hit it with a 2x4. You want to say, okay, this is the direction I want you to go into. It's a more gentle way of introducing I-26. Any side effects that we've had? I had one person say they had ringing ears. The ears were ringing. One person, I remember a guy in, where was he? He was in Oregon. And in fact, I think I've seen his name recently. And he told me that he had a complete intolerance to eggs, okay? Really, really gets sick when he takes eggs. And I told him not to use the I-26 except if he works with me so that we can make sure that he doesn't have any reaction. Well, some guys, they're pretty macho, said, I'm going to do it anyway. So he went ahead and he started with like 2 scoops or 3 scoops of I-26 every day. He called me back and he said, Dr. Hellen, I have to tell you, I didn't listen to you. I just started to super surf myself, and I was sick as a dog, like with flu, for 4 or 5 days. And now I have no problems at all. So the question is, what's the rush? Okay, you didn't do this to your body overnight. There's no reason you have to push your body to go to a certain position overnight. The only time I would say you want to do that is if there's something going on in the community and you want to be pretty sure that you're not going to, that your body is going to be able to handle whatever comes at it. So you take, maybe a quarter of a scoop, and then in the next 3 hours, take another quarter scoop or half a scoop. So just do it a little gradually, just to be kind to yourself.
Right. I mean, it's like when you start an exercise program, you're not going to run and sign up for
That's an excellent point, Trish.
an Ironman. Yeah. So
Yeah, right.
there was another question here, Dr. Helen. This person understood that the mother hen was injected with things that affected humans, and she would build up antibodies for those things and pass it on in the egg. Is that correct?
It is almost correct. The antibodies are interesting, but somebody asked a question about specificity for viruses, okay? What is more important in my mind, or as important probably, because now we're beginning to understand how important the intestines are, and that is there are small immune factors which are very, very what are called stable, okay? And these small immune factors are like the conductors of the immune system. So like they're cytokine-like. And what they do, those are the products that I think are even more important, or let's put it this way, are very important in order to help the body balance inflammation. So it's not only it's not only the antibodies that are produced, which are very important, especially mostly for gastrointestinal support would be my guess, okay? Even though there has been some suggestion that there may be some leakage into the bloodstream of what are called antibodies have two strands in a sense, and it's one strand. But anyway, the important part to realize is it's the immune factors which are more important. And if I also have a monthly blog, so if you sign up for my blog, you'll see articles every 2 months or so on the immune system and the importance of these immune factors. We do not, when we stimulate the hen, we're stimulating her only with inactivated bacteria. Okay, we do not use any viruses. They're not necessary. So we do it just, the way we did it years and years ago, which is we just stimulate her immune system with inactivated bacteria. She produces antibodies absolutely along with these very important immune factors.
All right. Oh, and I have a question here from Doris. She was under instructions not to take the I-26 with plant-based supplements, as both were strong supports for the immune system and confuse the body.
That's the way I like to think. That's my philosophy, that at the beginning, if you are already taking dietary supplements which are plant-based, which means they have more than one ingredient in them, then I like to suggest that the body may be confused and it doesn't know which way to go. So I like simple is better, okay? If you've been on herbal supplements for a long period of time and you really haven't found they've done much for you, then why not slowly back off? Again, you don't go cold turkey. Slowly back off and then slowly start the I-26. And then if you think you need it, you want to spend the extra time and effort on it, then introduce 1 or 2 other herbal supplements one at a time and see if it makes a difference. The key is you want your immune system to be in balance before you start throwing other things at it.
Right. That makes sense. And Dr. Wallach's products are all natural, plant-derived, and he really promotes the plant-derived organic minerals to help.
Now, the question is it a single ingredient that he has extracted those minerals from? Or is it the whole plant?
It is from an ancient seabed out in Utah. That has
on HPLC, when you put it on HPLC, high performance liquid chromatography, do you have multiple curves from that, peaks from that, or do you have a single peak?
I am not a scientist, and I would actually love to get you with the people who know that.
Okay, that'd be cool.
Yeah,
but look, if you have a plant-based mineral, okay, and you've been on it for a while and you feel great, then go ahead and introduce the I-26 along with that, okay, and see if you see a difference. If you don't see if you see a positive difference, then they're working together well. Okay. Right. If not, then let's talk. Okay, but my understanding is that those minerals, a mineral usually is a single, single entity. You either have, calcium, you have magnesium, etc. That doesn't interfere. What interferes is, I think, if there are 30,000 probably herbal supplements on the market. There's no way to predict which ones will work together with the body and Legacy I-26, and which ones may do nothing or may even negate. We don't know. It's all about how is it affecting the immune system. That's what the key is. We want to affect the immune system in a positive way, and for some of these products, there'd be no way of knowing until we use them together. But if it's a mineral, I'm not concerned. All right, if it's a plant, quote, if it's a mineral, that's usually a single entity, a single ingredient. But if it's an herbal product, there are usually many different components to it.
Right. Okay, makes sense.
Okay.
All right. And Marianne says that she's been taking all of her vitamins and minerals, for 5 years now, and added the I-26, and just absolutely loves it.
Yep, because she had that great foundation using all her nutritional supplements, and now she's introduced an immune supplement, which helps the body go even further than it was before.
Right, and
you have to have a good foundation. You have to have a good basis to build on. Okay, you cannot build a block if you have a concrete block which is crumbling. There's no way you're going to get any structure above it. But if you have a good solid block, then you can put other blocks on top of it. Yes,
actually, when I'm in the gym, I often use Charlie Brown's Christmas tree as an example of putting weight on the end of a limb if their core isn't strong.
Yep.
That's right. Very, very similar. And, Marianne's been eating very, very well as to not eat things that are causing, damage to the villi, microvilli in that intestinal tract.
That's right.
So, yeah, it's a 1-2 punch. I have another question. If everyone can indulge me for a moment, we'll do one more. Is there a problem using I-26 if there's been an organ transplant or joint replacement?
I have no problems with joint replacements, okay? Because, of course, what that's going to do is help the body with its recovery. My concern with organ transplants is that those people are at such a delicate position. And unfortunately, not all the medications that they take will help them not reject. My concern is that if they should start rejecting, guess who the medical profession is going to blame?
Yep.
Okay? So I don't want to go there. Now, if God forbid it was me, I can tell you I would be on it. Okay? I would be on large serving. But I'm not about to tell someone to do that, because the last thing in the world we need is for a physician to go, I told you not to take anything else. I told you not to take any supplements. You took them, and that's why you're rejected. Mm-hmm. Because rejection is rejection is something that occurs, unfortunately, too often in transplants.
Yeah.
In organs, okay? But certainly joint replacements, my hope is that if you are nutritionally, sound, and you take I-26, that you may find that your joints are supported in such a way that you don't have to take surgery. And Sandy, one of the women on the call tonight, has a friend, an elderly friend, both of us know her, who was able to, she was able to postpone her hip surgery for 8 years. As far as I know, she's never had that hip surgery. I have a guy who was just about to go in for shoulder surgery. And he sends me an email saying, "Gorgeous, I love you. I don't need it anymore. My shoulder feels great. Thank you." And that's what we live for, Trish.
Yes.
Okay, people who use I-26, Legacy I-26, most of us do it because it really makes a difference in people's lives, and we want to add to people's lives. When you're getting older and 40, 50, 60, 70, 80, 90. You want to have a quality of life. You're living it. You might as well have a good quality of life. Well, it's so much more likely you'll do that when your immune system is in balance.
Correct.
Okay.
And I can tell you from personal experience, before I knew about Dr. Wallach's information and the I-26, I had both my hips replaced 10 years ago. And, now that I have all this great stuff in my body, I am still teaching group fitness classes and training clients, and I'm 54 years old.
I mean, it's terrific, and it's going to stay that way. I have a couple in Portland, I think it is, somewhere around Portland. I just called them to find out if they had a problem with the fire that was going on there or whatever was going on there, and the rains. And he said to me, I'm 80, I think he's 84 years old. He and his wife still run a goat farm. They're running around after goats and sheep, and he has no help. He and his wife are the only ones who are doing it. And he says, if it wasn't for the I-26, I don't think I'd be doing this. I think I'd be like all of my friends, sitting around taking medication.
Yeah.
What's interesting is when your immune system is in balance, you don't need to take medication because you haven't gotten to the point where there's so much inflammation, as you suggested, that you have chronic disease. The doctor came in, the anesthesiologist came in to talk to him, and they said, because he told them he wasn't on any medication, and they said, look, this is serious. I think it's going to have cataracts or something. He's a cataract surgery. And the surgeon says, the anesthesiologist says, we really need to know what medications you're on. And he said, I'm not on any medication. And he compares it to his friends who have 14, 16, pills a day.
Oh, yeah.
He has to get the lock,
Yeah, I think the average 50-year-old is already on, or 40-year-old's already on 5 medications. So we're going to get this wrapped up because we're a little bit over time, and I wanted to ask Dr. Glenn if he wanted to add anything, and if not, Dr. Hellen, gosh, I'm so appreciative of having you here on the team. There's so much more we need to know and share with the whole Longevity Corporation that would love to get you in front of everybody.
As long as we can get Legacy I-26 in front of everyone, you've made me pleased.
That's what we're doing. That's
Dr.
what we're doing.
Glenn, how are you? It's so good to see you.
It's good to be here. I had a cancellation today, so I was like, oh my gosh, I got to hear Dr. Hellen. So.
Oh, good. Oh, you're so glad.
All right.
Do you have one little nugget you wanted to give?
One little nugget. Gosh, there's so many nuggets. Let me put it this way, and I'm going to say, because I want everyone to hear, including Dr. Hellen, that I really believe that this is the most important development in medical science since the discovery of antibiotics. And I stick to that time and time again. It has changed so many lives. It has made such a difference in so many people's lives through the years I've used it. I know Dr. Hellen's had similar experiences. Get this product out in the marketplace, get people using this product, and then watch what happens. In fact, just happened just today. I delivered some product to a woman, and now I'm not sure the disease. Her dog has some illness, right? I forgot what it was, and she's taken some kind of a bile acid for the dog. And so Franklin's a little cute little dog, right? Anyway, so we're going to start the dog on a half a serving a day, and I can't wait to see what's going to happen, because I know many times when something's wrong with someone, you don't know, the doctor is giving them this drug, which is the bile acid, which has some medical benefit. But I know that if we can just add this product to this dog's life, essentially, it's going to make a difference. It may not be exactly the issues with the gallbladder, but it's going to be a lot of other, he's having skin problems and everything else. And so she came around with the idea, well, I'm so desperate. What I do is, well, try the I-26 on him. So that just happened today. And this happens all the time.
I'm adding this to my dogs.
Yeah.
Oh, that's wonderful.
Yeah.
And I can tell you what's very interesting is people will go, well, how do you know it's not just a placebo effect, that people are imagining it? Well, the answer is, as Dr. Glenn has just suggested, that if you give it to pets and children, you can see the results in them. And they don't know what that kind of effect is, It either works or it doesn't work. And it works, guys. It works.
Yeah.
So I want to share something because, and it's not necessarily an I-26 testimony. However, it is a testimony for everything that we're talking about. But we had a gentleman come in this summer who needed a knee replacement. He had talked to 4 different doctors, and basically he was going to be scheduling something between Thanksgiving and Christmas of this past year. And anyway, this guy came in to sell us cancer insurance. We turned him on to Dr. Wallach, and this was kind of, before actually I-26 was in here. So I'd love to see him participate in, using this product as well. However, for 90 days, he did the bone and joint, the protocol, and he told his wife said, when are you having your knee replaced? And he said, I don't think I need it. And she told him, I think you've been hypnotized. You've been brainwashed by this. And so he went in to the doctor today. They took x-rays. She said, oh, I'm so excited for you. All this exercise you've been doing, you've grown your cartilage back in your knee. And he goes, no, I think it's the products I'm taking. I think it's the supplements. And she goes, oh, no, they don't work. But this guy is so excited.
Well, yeah, they really are not allowed to talk about it.
They what?
Doctors are not really allowed to talk.
I know. So I appreciate that. And I have one more testimonial where a friend of mine has been on the bone and joint. She decided that she was still going to have her knee surgery, so she did. And when they went in and when they cut her knee out, they noticed something was growing on her knee and also on her other knee. And they said they didn't know what it was. They can't imagine what it is. But I think the products she was taking, they were starting to work. She just was impatient and couldn't wait for that. So I think
we've had the same exact.
Go ahead.
We've had the very similar results, and what the physician said when he saw what was growing there, he said it was pre-articulate cartilage, which he said he had only seen in infants before.
Yeah, and so I think that's exactly what was going on. But what I want to say is I think with these products, with the I-26, what we're seeing is unbelievable. And like you said, Dr. Hellen, and it's about having a quality of life. And so when you're able to do that, and still be very well. I'm not on any medications. I'm actually going to be 60 this year. And for me to say that out loud, it's like, oh my gosh, and people see me and my activity and they can't, believe that I'm close. And just like Trish, working out and doing her training and what have you. And so I'm so excited to have I-26 as part of my regimen every day. And thank you all. Thank you, Dr. Glenn and Dr. Hellen. I really, really appreciate everything that you guys have done, and so excited about having that be part of what we're doing.
And just to sign off, that this is recorded, so if you need to, when you get the recording link, to send it out to anybody, you'll have it. We're going to post it on the Legacy for Life Facebook page.
Yep, we will post it on there. I'm going to post on so I have a little page that I have, it's Legacy for Life, but anybody can go there. And it's on my my personal website, so I'm just going to put that there. And I actually have Dr. Glenn's recorded call from 2 weeks ago, which I sent a link to my son, because I really want to get in with him and his, the athletes that he's working with down there. So I think it'll be great. So thanks, everybody. Thanks for coming.
Thank you.
Trish, thanks for putting all this together and working with Dr. Hellen. And Dr. Hellen, thank you so much for coming on. Really appreciate it. We appreciate all of you. I mean, there's Sandra's on here, and Andy and Vince. There's tons of people. There's there's a lot of longevity people on here too. A lot of I-26 legacy people. So thank you. We even have somebody from Australia. So Elaine Asher, thank you so much for coming on. And you guys all have a great night.